Cluain Fhionnain was set up specifically in 2001 with residents who had dual diagnosis of intellectual disability with a mental health diagnosis as well. The majority of these residents would have graduated from St. Fhionnain's Hospital, which was the main psychiatric institution. A lot of the staff who would have been mental health nurses in St. Fhionnain's Hospital transferred down to Cluain Fhionnain. And although the institution itself was new, the care remained very much the same.
Mark's quality of life, it would have been poor. Living in institutional care where you didn't really have a choice of your food, you didn't really have a choice if you could shower every day. It was just an amazing thing to see, like someone that appeared to me so independent, didn't have access to a bank account.
Baldybean is now place, but to the porch.
Just always watching me. I did not have any freedom.
Tim would have been a gentleman that would have kept very much to himself when he was inside in the unit. I really do believe that the time he was here was a waste of his life.
One of the staff one day was walking down the street with Tim and he met a guy he hadn't seen in years, and they said to Tim, "Jesus, Tim, I thought you were dead. We hadn't seen you in so long." But he was so long gone from his community. You know, it was just heartbreaking.
All of that, though, changed when we changed over to a social care model, and when we got SRF funding. Rehab Care came in as a partner agency, and they provided 98 hours of transition.
We've been working to transition approximately 31 individuals from the Cluain Fhionnain project into individual services in the community. It was done at each person's own pace, how they wanted to do it.
As all the houses were identified and the residents knew where they were going, we started introducing them to the facilities in their communities. And what that meant was, because we were doing it on a one-to-one basis, the residents were known by the locals individually. The whole idea of this is to integrate into the community, not just put somebody in a house and create another institution.
I think one of the difficulties for us is understanding, I suppose, the repercussions of choice. You can imagine in some cases where people have been in there 40, 50 years and having the same routine over and over again. And then you've opened up this door to, you know, I can choose whatever I want.
When it came to, say, meal times, they were picking the same meals kind of maybe all the time, not knowing that they could decide on something else. One of our ladies had never been to a grocery store, so asking her, did she want to go grocery shopping, was a huge decision to her. Do I want to go? What's it going to be like?
We started the family forums. I think they were afraid that if it didn't work out and Cluain Fhionnain was closed, where were they going to go? Me saying to somebody, he's going to be fine, is not good enough. You need a mother or a father or a sister or a brother to come along and say, my son was in an institution for so long and now he's doing brilliantly.
But my brother forgot to move apartment.
I asked when I was looking to move, I asked my brother, but my brother was actually afraid that I would move. And then the staff supported him to be able to support me to move.
My brother, okay.
And then my brother was okay about it and I was okay.
A move for anyone is a major milestone in your life. These residents had great understanding, showed great patience, and they ran out of the place, which was absolutely brilliant to see. And I just think that in itself just says it to you. They needed this change.
Annette is in her 60s. She moved from the Cluain Fhionnain residence in Ballygerbeen in 2015. Moving day, everything was ready for Annette at the house. She had picked the colour of her room, that was painted. We were ready also for her to maybe just visit and go back if she wanted to. But that day, no, she had her bags by the door and she was ready, and she hasn't looked back.
She has been going out, joining groups, going to old folks' parties and things, and that's something wonderful for her.
Mark, obviously learning how to cook was amazing. Manages his finances absolutely independently. He's involved with church groups. He's heavily involved in the deaf community also in Tralee. He's a real part of his community.
Mark is absolutely brilliant, has gone overseas on holidays on his own. He's lovely.
Tim is an absolute gentleman, well capable of making decisions, and it was really, really lovely to see him move into his own home, you know, with staff support.
He's very independent, like even he'd help out washing away or drying them, and he's well able to wash his own clothes, and he's and takes his own tablets. Yeah. And he'll tell you everything. And yeah, he pays all his bills, and he's great. Like if he sees any of the neighbours walking down, he's at the door waving out, and they call in for tea, and he goes to the day service with one of his neighbours.
There's a confidence that he has gained. You can see a contentment and happiness in him that was never in him when he was here. Never. It can't be done without partnership. It just cannot. There's so many groups that have come together. We need to be continuing putting in supports and see what potential is there for somebody become more independent. Otherwise, it is a failure. It has to move on. It has to grow.
I got campaigns, moon the fire, got which shoes me and toes. I go in the gym, I go on the gym, I pay exercising and born. I got mass every Saturday night. I be my host now.
You need to stop judging somebody and saying they'll never do it, but look past that and look for the positives. Everybody has the potential to move on. Everyone.
Mark makes his own decisions. It's his life that no one dictates.
I now feel confident, I'm happy, I'm busy, and I'm busy in the apartment.